Now, with close to 8% of South Africans fully vaccinated and registration now open for the over 35-year-olds, the government's vaccination campaign is finally starting to gain some momentum. Healthcare workers on the front line are beginning to feel the benefits of government's efforts to vaccinate as many South Africans as possible. This in the hope that herd immunity will offer some protection against the spread of the virus. Family practitioner and founder of Gauteng General Practitioners Collaboration, Dr. Karin Van der Merwe, joins us now to talk more about this. Dr. Van der Merwe, good to have you with us tonight on Newsfeed Late Night. Talk to us about the drive to educate South Africans on what you have termed the benefits of vaccination. What brought this about?
Well, as the GGPC, the Gauteng General Practitioners Collaboration, we've in general been trying to educate folk about everything to do with COVID. There's so much misinformation out there about COVID. So on our Facebook page, if you're interested, we have a lot of information about COVID and especially about vaccines, because vaccines is what is saving lives at the moment. We've got the patients that are ending up in ICU all have one thing in common, and that is that they have not had a COVID vaccine. And when a patient comes into my rooms and they tell me they've already been vaccinated, even if I find out they've got COVID, I know they're not going to get critically ill. So vaccines are really working. We all need to get behind this drive. It's wonderful to see partnerships between public and business and even organizations like Wimpy giving away coffee to people who've had vaccines. We all need to get behind the vaccination drive.
And how has the response been from those that you've been communicating with?
Most of my patients are very much on board with having the vaccine. They understand the benefits, that it's going to protect their healthcare, that of the community at large. And of course, you do get your odd anti-vaxxer that doesn't believe in vaccines, and we do our best to educate them. And I always say, arm yourself with information. Don't just believe everything you read online. Go and find out from true sources and learn the truth about vaccines. Because if you look carefully, you'll see that the vaccinated countries are the ones where people aren't dying of COVID anymore. And the folk that are getting vaccines are the ones that are surviving. So that's the message we need to get out there.
So, Doctor, how do you deal with patients who would say to you that they've heard of some people who have died after taking the COVID-19 vaccine? So for them, it's perhaps not even something that they've heard about, but it's something that they know. They may know somebody who's actually gone through an experience of that nature. How do you respond to that?
So the one problem is always proving cause and effect. So, you know, we've had 6 million people have a COVID vaccine, and we've had people die. Now, did they die from getting the vaccine, or would they have died anyway? So there's always that question around things. I mean, the truth is the severe side effects of vaccines are extremely rare. And if you look at the studies that have been done, people are not dying from getting these vaccines. So it's extremely rare to die from a vaccine. I mean, it's not impossible, but it's like hen's teeth. It's much more common to die of COVID. I mean, we can all think of people in our circles that have died of COVID. And yet in the vaccines, I mean, in South Africa, there really isn't a absolutely documented case yet of someone who definitely died of a COVID vaccine. They're being investigated, but I believe that's probably not going to be a cause and effect.
And what about people with comorbidities, perhaps, or people who have had heart problems, or who are diabetic, or who are perhaps not feeling too well right now, and they receive the message to go in and vaccinate? What do they do? How do they deal with that situation?
Well, those with comorbidities are the ones that it's actually the most important that they get the vaccine, because those are the patients who, if they do get COVID, they tend to get a very severe COVID. So they really need to, by hook or crook, get to the vaccination centers and get vaccinated. And we need the community to help. You know, sometimes you actually need someone to go and fetch elderly relatives and take them to the vaccination stations. Or and normally if people are quite frail and fragile, they're very understanding. They'll let them go to the front of the queue. But that doesn't mean they mustn't be vaccinated. They really do need to get vaccinated. There are even organizations now that I've become aware of I know in the Jewish community, Hatzolah, for instance, are taking vaccines to patients' homes. So that's not impossible. But it's the most fragile and the most frail, the people with the most comorbidities who need the vaccines the most.
We're hearing government saying that South African men are rather hesitant when it comes to taking the vaccine, or at least they're not signing up as much as it was expected. Your comments on what could possibly be behind this?
You mean men specifically?
Men specifically, yes.
I think women are always just more brave. I don't know. I can't understand that. And funnily enough, men get worse COVID than women. We have more men that die of COVID than women. So the men really also should be signing up more than the women. Women are in general better at seeking out healthcare than men. If you look at across the board, men are more reluctant to go to a healthcare facility, and maybe it's a similar thing.
And how does one get around this? How do you encourage men to go, for example? What do you do when you are faced with that situation?
Well, you try and get to the bottom of why they don't want to go. You know, what concern do they have? Maybe they have a concern about fertility, for instance. So that seems to be a concern, and that concern is really not valid. There is no evidence that the vaccine affects fertility at all. And the fertility organizations and the British Medical Journal have come out in support of the vaccine and said that it will not affect fertility. But there may be another issue. They may just be complacent, think that they're healthy, that they're not going to get the vaccine, maybe not thinking about that they could also be transmitting it to the community. So it's about sitting down and really teasing these issues apart and trying to find out the root of the issue.
And how does vaccination affect pregnant women?
Vaccination has also not had, there's no evidence to show vaccination has any problem with pregnant women. And we are advocating it from the second trimester, so after 3 months of pregnancy. Most drugs we don't give in the first 3 months of pregnancy. That's just across the board. But from the second trimester, billions of women have had it, and it's absolutely safe. And it's actually quite crucial because pregnant women also get much more severe COVID than non-pregnant women. It can affect premature birth and all sorts of things. So if you're pregnant and you're after the first trimester, I would encourage you to have the vaccine.
I must say, though, Dr. Van der Merwe, there isn't anybody who has been vaccinated who has actually, carried to full term and actually delivered a baby. So, and that's only because the vaccination process hasn't really lasted up to 9 months. So how then can we guarantee that the baby will be safe and that there will be no sort of negative repercussions on the fetus?
So obviously that's a valid question. Remember, some countries have been vaccinating much longer than South Africa. So we do have some countries where babies are starting to be born, where vaccines were already given. So all that data will come to the fore. But as I can say, there's no bad evidence. There are lots of other vaccines, very similar vaccines have been given to pregnant women. There's never been an issue. And so we don't foresee that being a problem.
And women who are breastfeeding?
Women who are breastfeeding can definitely have the vaccine. It's actually a great idea because you then make antibodies to the COVID, and the antibodies are transferred in the breast milk to the baby. So the baby actually gets a measure of protection as well. So it's a bonus to have the vaccine when you're breastfeeding.
All right, we'll leave it at that for this evening. Dr. Karin Van der Merwe, family practitioner and founder of Gauteng General Practitioners Collaboration. Thank you very much for that time.